don't tell others what you've seen, there is no point. Okay, so you need to be very clear. Some of the points pointed out. Yeah. So obviously indication. I'm sure you all have different reporting system. This is the reporting system. This won't probably not be in the USB data. This is our own Sharia made endoscopy reporting, recording, and whatever system. So extent is indications, of course. If you look at sedation on the right, so you have to put how much sedation you gave. Indications, and then there should be in my report there is a column here of bowel prep right there. So it tells me whether bowel prep is fair, good, excellent, whatever, adequate. You can use whatever terminology. Then the most important thing is then when you're reporting, you need to put extent. So I know straight away you've been to the terminal ileum. Great. Okay. Nice to have pictures, but depending on who is doing it and how experienced and how much we can trust the person who's doing it. Now, in the findings, it's important. Firstly, you don't put centimeters, please. Those who've done courses with us, other than rectum, please don't put centimeters. It will be embarrassing, very embarrassing for us. That means we haven't taught you anything. So you write, I'll tell you, when I'm not sure, I say, well, I've been to sigmoid. Sometimes you get an idea, you've just passed the rectum, it's probably distal sigmoid or proximal sigmoid stroke, distal descending colon. If you're pretty sure, splenic flexure maybe, but I always put a question mark because I'm really never sure. Okay, cecum I am, rectum I am, the rest I'm not sure. So, and when you're reporting, you need to report your findings. For example, there's a tumor. Is it circumferential? Okay. Is it polypoidal? Ulcerating? What kind of tumor is it? Were you able to pass without difficulty through it? And did you examine the whole colon or did you not? It's very important. Similarly, if you have a distal rectal tumor, you have a rectal tumor, the surgeon wants to know how far you are from the anal verge. It's very important to tell them you're 5 centimeters away or 4 centimeters away or 2 centimeters away or 1 centimeter, whatever. But that's the most important thing a surgeon wants when doing a rectal tumor assessment. Ulcerative colitis, when you see ulceration, you put full details. You saw ulceration, you saw loss of vascular markings, you saw whatever you saw, you must put it there. Pseudopolyposis, it was diffuse. If I was just discussing, if you put diffuse involvement of the mucosa, we think ulcerative colitis. You say patchy, you start thinking of Crohn's disease. Okay, simple things. Retroversion, I was able to retrovert. It is not always necessary and it is sometimes not safe. Don't do it in children because it's not really necessary. Okay, unless you are really suspecting something in the anorectal region, in which case you need to use a small scope, and sometimes you can use the gastroscope to do it in kids, so that's not a problem. If you can't do something and you find resistance, there is no harm changing your scope or asking somebody senior. Don't cause a simple diagnostic colonoscopy to become a complicated one. So this is what we do, and end of the day you can put a conclusion there which can be simple, straightforward, but the more details you put in, the better it is. Biopsies taken, polyps removed, polyp retrieved, site of polyp, size of polyp approximate, all those things should go. Pedunculated polyp removed. Where? What size? What did you think of the polyp? Okay, so I think it's very important. If you're biopsying something, you need to ask why. So those answers should go there. Your own question should be answered there. Last but not the least, we cannot do anything without our histopathology colleagues. And they can't do anything without you sending them information. So when you're spending so much time doing so many things, spend a few minutes. In our system, there is a column here, if I can go straight. Ye khul jayega na? So if I go biopsy request form, okay? So biopsy request form will have, now what I know here is that if we just put, it will only put mainly the conclusion. So if the conclusion is normal, then obviously we haven't done anything. Otherwise, if there was anything abnormal on the conclusion, the whole report will go there. And so we just print this and we send it along with the report. In some of the difficult things where I'm really not sure, I actually send the whole report. Make an extra copy and send it with histology. It's very useful for histopathologists. We go and talk to them. So, because end of the day, it has to be patient-centric. We are all here to help our patients, not get 97% or 98% cecal intubation. It's useless if it's not helping your patient. Polypectomy, whatever you do, it has to be patient-centric, and this is very important. Histopathology, don't just put biopsies taken. Aga Khan histopathology sometimes will write back no information given on the basis of information, and which is very fair. Okay, do always put a plan. And what do you plan to do after you've done it? In conclusion, I would put, if it's a CA, then I would say CT scan of the abdomen requested, review with the CT reports and histology. Okay, referring for surgical opinion, so that the patient report actually tells me, because in our system we don't have like what happens in UK. One patient goes to 10 doctors or 5 doctors or 3 doctors. Okay, any question on this?
I'm asking about the certainty of the polyp size when we removed.
Approximate. It's an approximate size. No, it's an approximate size. You can say it's about 1 centimeter. If it's not 1 centimeter, but 1.1 centimeter or 1.2 or 0.9, it makes no difference. But obviously, if it's a 5 mm polyp and you write a 1.5 centimeter polyp, then that is not going to happen. So it's an approximate size, and what you can do is once you've taken the polyp out, you can actually measure it. You can also measure it when the polyp is inside, but once you retrieved it, it's much better measured than. Pathologists will actually give you the size. I usually say more than 1 centimeter polyp, and then I don't bother measuring because it's significant.
But the incomplete excision
Oh, that you have to write. When you're doing a polypectomy, you have to write. I completely removed it. It was a pedunculated polyp removed, completely. No, completely, okay. So complete removal, endoscopic removal, and then you wait for histology. If you've done an EMR, you have to tell them you've done an EMR. With a sessile polyp, you've removed it by EMR. So you need to give that information to histopathologists as what you've done. It's very important. And we must bring, this practice is not existent in Pakistan, I'm sorry. 8 out of 10 of our requests, especially done by seniors. Juniors are better. As you become more senior, you give less information. That's what I've seen. So I think it's a bad trend. Okay, everything is recorded in our unit. It's very good. You should start whenever you're starting. Where you're working in very good units, you already have systems which are good. But when you're starting your own private, even in your own practice, you should have a habit of keeping all the record. It's always useful. Any questions? Thank you very much.
Okay, with this we come to our last session, which is the feedback. And I really hope that you had learned a lot. And what we would right now like you to do is to briefly tell us how this course has made a difference and what do you think needs to be changed or anything we could have done differently. Okay, so we'll like to hear first from the hands-on, and then we'll like an input from the observers as well.
It's not obligatory, and you don't have to say good things. You have both the options.
This is your time to take revenge from me.
Yeah, you can. This is your time to actually.
Sir, everything was good. One thing that I would say is 3 seems to be a bit small and 5 seems to be a bit more. Should be about 4 days. Because learning from 2, applying from 1 on 1 would be better. Learning from 2, applying on 2. I would prefer that. Prefer it that way. That's my suggestion.
Well, I had very great time, and thanks to all of you for the kind and everything was perfectly fine for me. And I'm really waiting to go back home and apply all the skills I learned here, especially the movements the thing which we are doing wrong, and the extreme movements, stock movements, everything. So perfectly fine, very well organized, and I will definitely looking forward to do more like ERCPs or advanced colonoscopy workshop as well. So thanks a lot to all of you. Yes.
So that's why we've struck exactly the same thing. With ERCP, the course is for 4 days. That's in the UK as well. And we've done it 4 days here as well. So it's just an exact replica of the course there. So that's the reason for it.
I think it's good, and 3 days are sufficient to learn the basics, and we should, if we apply all these the maneuvers on the next patients and next colonoscopies, we can find ourselves more. Otherwise, the course was very good and all cooperative.
So again, it's a very good course, and the environment was very friendly. And the best thing I saw that the staff was again very cooperative. He was very helping and motivated. So it was the best thing. I have worked at JPMC in civil hospital in different departments in Akhan, at Ladkhana. I found the staff is very good, very cooperative.
Hello.
Well, everything I wanted to say has already been signed by my name fellow, Yasir. I think at least the number of procedures, if there could be more, if we could get more practice under your supervision, it will help much better. But as the basis of the principle of this workshop is to just teach us the principles, the practice we have to do, so it's okay, I think.
A very nice course, and that from my level, that I really don't know about the importance of position and outer portion of a scope, that we have to handle that as well. We only play with the inner portion, and really we, even through my whole course of training, I don't know about these things. So it's very fruitful for me, and hopefully I will be in the next hands-on. I am hoping for that. And one also request to Sir Sadnyas Sahab, that I am alone in a NICH, that I need further guidance from you people and help to make a unit at there. This course was very fruitful. Thanks.
Hello. Thank you to everybody. Being even on the observer state, I think we have learned the basic principles of how for the maneuvering the scope. That's very important. Though being a surgeon, we never do that kind of a scope in terms of number, but at least we should know how to do that. But next time when you come up in a hands-on, we should have the homework done, being on the principles, and then the hands-on workshop will act as a dopes for us next time. Okay, how much improved we have done from 0 to 50 or 70% what we've achieved or not. Thank you.
Feedback from the trainers?
Well, it's always a pleasure to come here. And again, at this time my schedule was very rushed. I could only come just for the 3 nights basically, but still, this is something which is very close to my heart. This unit is my home unit in a way, though I do not work here, but I come here frequently enough to claim it as my own. What we do, we take the glamour of it, it's just like, but most of the work, if you do not realize, is done by people like Sajda Shahryar, without whose effort this course could not be run at all, because all the groundwork, all the background work is done there. We have the patronage of Professor Saeed Qureshi, who has been trying to get this up and running for a long time, and he's been sort of twisting my arm to get it up and running. Saad and I have worked on it for many years before we actually started launch the courses, first for ERCP, then for colonoscopy. And most of all, I'm grateful to my best friend, Paul, who, in spite of the political situation is a lot better now, but when it was really, really bad, he decided to come with me because he was coming with me. He trusted me. So that is something which I'm really grateful to him, and I'll always be indebted to him for the rest of my life, because we are at a stage that I'm almost, in a few years I'll be thinking about retirement once my children are up and running. But we need to transfer our skills to the younger generation who can carry the torch for us. And that is my main desire, because I know the culture here. The people who are in a position to teach are very territorial. They wouldn't transfer their skills to others. But that is the wrong thing. Nobody's going to grab your share of, everyone has his own destiny. You would get whatever is destined for you. But the important thing is that if you got a skill, if you got some knowledge, you must transmit it, because that's how science and art progresses. And this is what our aim and objective is. Though it is a drop in the ocean, but we expect you people to carry on this work further. So this is something, and we are very fortunate to have two very young and aspiring faculty members in the form of Sajda and Shahryar, who are going to carry this forward for us. So because I'm not going to be here forever, Saad is, we are at the same sort of level. Paul, well, he's very energetic, he will still continue. But the thing is, we've got younger people amongst our colleagues who are more energetic, and inshallah they'll carry on the work, and you people would carry on the work. Thank you.
I'd like to say that coming to Pakistan has been absolutely brilliant. I love it. I look forward to it. And the day that I leave, come back again the second time, I cannot wait for it to come around. The people I see as, wrong to say extended family, but as family. So it's absolutely wonderful. Brothers, sisters, everything. It's absolutely superb. But the main reason for doing what I do is that I love seeing people's faces change from day one to day 3. Seeing somebody who's nervous, who's relaxed, and seeing how that transforms. Like my friend here, I'm looking at retiring in 2 years' time. He's a little bit longer than me, but retiring from full time and then going a lot more into teaching a little bit more. And that's my ambition. My wife is exceedingly supporting, hence she wouldn't be here. And I've got some very supporting friends. The difference between Pakistan and the UK, you need to bear in mind, is this. In the UK, there is an expectation. You're a registrar on the rotation, you expect your training. You turn up and you say, I've turned up for my training. As I said to one trainee once, it's in a box, it's in a corner over there. And that's how sometimes it makes you feel how a trainee in the UK perceives what they should be getting. In Pakistan, it's different. Trainees turn up, trainees are hungry, they want to see everything, they want to know everything. They ask all sorts of questions. Some people may think that these questions, you may think, should I be able to ask this? You should realise now any question can be asked, doesn't matter what. So to conclude, the most important thing to me is to enjoy. I enjoy it. Hopefully you've enjoyed it. And this time, just to let you know into a secret, I managed to keep my trousers up.
I think the course, it's great to see the 7th course. It's been a very interesting and exciting journey for all of us. It wouldn't be possible if you were not here. The whole course is about you. It's trainee centric. So as long as you got what you came here for, I think we are happy, and we feel that we have achieved something. And that's why we want your feedback, because we want to cover up anything that we might have missed upon or we could improve. It's a dream that's now a reality, and I hope that it continues, and one day we'll be sitting here with hopefully, 20th and 50th or whatever. We won't be here probably for the 50th for sure, like, it should continue, that's the main thing. And so in your departments, wherever you go, if you take this further, then we have actually, it's part of our success as well. So I hope you all you enjoyed. And obviously it wouldn't be possible without these two sitting next to me here. They have been amazing. They have come here the 7th time. In fact, Bakar the 10th time, because he also comes for the ERCP. And he has nothing here, no family in Karachi. Paul doesn't have anyone in Pakistan other than new family. So, it's a big undertaking and effort that they make. And of course, we try and support them in whatever way we can. So let's hope that this continues. And what I want to emphasize again upon is that hopefully there will be a message that will be sent to you. We would want you to log on to it. You can update us about how your progress is going. And in that progress, if you want to ask something, if it's going to be centralized, so we will all have access to it, hopefully. And that way we can help you more and also be part of your success. Okay, thanks everybody.
If you have anything to discuss or anything, by all means, please. Even the announcement of the birth of a new baby in your family. Because you are like a family.
Okay, thank you very much. It's always very good to be in limelight and to be given credit for, but it would not be very honest of me if I don't acknowledge my team. First of all, my very dear colleague and a friend who's always there behind me, helping me in everything, Dr. Shahryar Ghazanfar. Dr. Shahryar, Dr. Shahryar never says anything, so this time we are going to make it a little different. And I would now request him to give few comments. Shahryar.
Thank you for inviting me to speak. I think for the first time, that's the 7th colonoscopy course, and this is the first time I'm speaking here. I do everything in the background. Usually I'm the technical person doing all the computers and the audio and video stuff. And what you have seen in the endoscopy, the database system, the recording system, all done by me. So I usually like to stay in the background, not here. Thank you.
Okay, thank you, Shahryar. And now I have to thank a very dedicated team of mine. We had very hardworking doctors, Dr. Salan, Dr. Noman Khan, and Dr. Maheen. Thank you very, very much. And a special thank you to my staff and the technicians, of course. And then we cannot but thank enough our sponsors for this course, Ferosans and Mr. Zaidi from BNN. Thanks a lot. Dr. Saab, would you like to say something?
I just wanted to tell you that I'm really grateful to Ferosans. They have sponsored the entire course. It obviously, my colleagues here or us, we don't get anything out of this course. But traveling arrangements, staying and lodging and the whole arrangement, obviously it costs. And this is the first time Ferosans has actually completely sponsored the whole course, for which I'm very grateful to Ferosans and Boston, which is the same. And other than that, I think, you continue and thank, but I had to thank them because they helped us in the last. I only wrote to Usman 2.5 weeks ago that I'm stuck, I have no funding. Previously Getz Pharma funded our courses, but this year they couldn't for whatever reason, and so I was stuck. And fortunately, they stood by us, so I'm really thankful.
Now can I request Dr. Wakar, Paul and Dr. Saad to please come here and distribute the certificates amongst the participants. Okay, now first of all we'll start with our hands-on candidates. Dr. Yasir Abbas Zaidi.
Player all 3 days, especially with you. It's fine.
Dr. Khurram Malik. Dr. Majid Ahmed Sheikh. Dr. Salman Afsar.
Selfie king, selfie. Selfie Salman.
Dr. Yasir Abbas.
You are fortunate to have instructions in Pashto.
Dr. Munira as an observer. Dr. Kiran Nas.
Kiran started with helping us in
Yes, that's right.
enlisting, and now she's come to.
Yes, very good. That's
Next time hands-on.
hands-on, that's right. That's slow progression.
Dr. Arit Prakash.
Guaranteed.
Dr. Yahya Afzal.
Next time hands-on.
Now we like to give a token of appreciation to our technical staff, Mr. Akram Rahmat. Dr. Zubair Ahmed. Oh, sorry, Zubair Ahmed. We have a doctor as well, so we've got lots of Zubairs, so it's always very confusing.
I had to put up with him for 3 days. Well, very good.
Eric James. Reema Parvez. Zakir Ali. Staff Shahnaz. Staff Shabana. Staff Mariam. Aslam. Habib. Is Habib around? Okay. Anthony. Prem. Lakshmi. Mohammed Baksh. Amir. Amir. Sagir. Is Sagir around? No? Okay. So now for volunteers, Dr. Noman Khan.
Very hard work.
Dr. Muhammad Arsalan. Dr. Mahin. Okay, Habib. Is Habib here? Okay, now we have to give. Okay, so it's Zubair Ali. And my right hand during all the arrangements for the course, Waqar Khan.
This is for me. It's not mine. Well done.
Okay, Muhammad Zubair. See, there are 3 or 4 Zubairs. Janet, number 2. So now token of appreciation to Mr. Zaidi from BNN. And Adil from Pharaoh Sons. Now, I'll request Dr. Saad Niaz to give a token of appreciation to Dr. Waqar Ahmed. Paul Hagen. Dr. Ali Taj. मेरा गला बैठ गया. Where's Ali?
He's gone for lunch.
He's just gone for
The second lunch.
Okay.
Probably winding up the extra. We might
Yeah,
have
maybe
left
he's
something.
that. Yeah. Dr. Shahryar Ghazanfa.
The power behind the button.
And
Let me announce this one.
okay.
Paul and Vakar, can you present it to what's the name? Is there somebody? Professor Sajda Qureshi.
Okay, Ali is here. Ali Taj.
Don't worry, just by looking at him, you may feel he doesn't, but we make him work.
Now, last but not the least, Dr. Saad Khalid Niaz. And this time we have got a very special shield for a very lovely person, Janet Hagen. And we will request Paul to please present this to them.
I can't let him give it to you. No, it's not.
Okay, thank you very much. And I think if anybody wants to leave, we have a small skit and a presentation, not a presentation actually, a small musical thing at the end. So, are we ready for it? Okay.
Now we're in the social.